Hi, so you've just had your tummy tuck, now what do? Well, in your stuff that we will send you home with, or that you might already have, let's go through some of the components. This is the sequential compression device, or SCD, comes packaged in a box. You will likely wake up with this already on. Now, there are times where the battery has been discharged before, or just from the factory, and so sometimes we have to charge it beforehand. This is the charging cable. If you can charge your cell phone, you can charge these things. The charging port is at the bottom. Again, you will wake up with this on you, but basically there are some Velcro straps. It goes around your lower leg. You're gonna wear this thing around the clock unless you're in the shower. So that's your SCD machine. Let's talk about some wound care. So some fundamentals. To have at home, I'd have a bottle of hand sanitizer, and then I'd have some antibacterial soap. Dial is the most recognized brand, but there's lots of antibacterial soaps. I'd have that as well. And then a bland soap, a Vino, something that you might wash your entire body in. Okay, so let's start with drain care. So coming out of the side of your incision, the edge of your incision, will be some silicone tubing attached to a bulb. The way this works is once the bulb is expanded, and the bulb will stay expanded off and on for the first 2 or 3 days because air leaks through the incision. That's normal. There's a stopper mechanism, so we take the stopper out of it, right? We compress it down, and then we put the stopper back in, and that re-engages it, and you can hear the air whistling through it. Now, as it fills with fluid, and it will fill with fluid as the day goes on, you will empty it. So you'll take the stopper out, you'll look at the number that corresponds to how much fluid is there, 25, 50, 75, 100. You'll write that down on your chart, and then squeeze out the fluid, throw it away, and then clamp it back, and then you're in business. That's your drain. Okay, we're at early on, and we're just gonna do some dressing changes. We're not quite ready for the shower. Perfect. You either go wash your hands, or at least the sanitizer, do that. All of your dressings come off. You can take a washcloth with the antimicrobial soap, little gentle wash, pat dry, and let's talk about the dressings. We're going to use these abdominal pads for everything. They're non-stick and they're very absorbent. We're going to use them in 2 ways. So right after the surgery, we're going to make sure to cover the entirety of the wounds. And we'll fold it either in half or in thirds, and we're going to cover the entirety of the wound. When we get over to the drain side, what we're going to do is we're just going to fold it in half. We'll take scissors, make sure they're clean, and we're going to make a notch. And the purpose of the notch is so that when the drain is coming out of your body, we take the dressing and we put it around, and then we tape over top. And the tape we're going to use is, it'll come packaged, but it's Metapore tape. It is very skin friendly, and we'll just use a little bit. So above and below the dressing to hold it in place, and then all the way across for the ABD pads. In the early days, meaning days, let's say 1, 2, and 3, we'll take a little dab of bacitracin ointment, and we'll put it around where the drain site exits, and then we'll put our dressings on, and that's it. Okay, now we're ready for our shower. So we take our shower, soap and water comes from behind over everything. Of course, all the dressings are off before we get in the shower. Then at the end of the shower, we take our antibacterial soap and we wash the incision 1 more time. We pat it dry, we get out, and then we put our dressings on just like we talked about. If we're at day 3 at this point and there's no drainage from the central section, then all we need to do is 1 pad for each of the drains, and that's it. I hope that's helpful.